I don't want to speak too soon, but I think now that we're, about 2 years and change into this pandemic, are we about over yet? Well, at least we got some numbers coming out from it. And what exactly did the pandemic accomplish? Well, it helped mitigate COVID deaths. We can definitely see that. But you take a look at the people that actually died during the pandemic, and there was more people dying of anything but what it was designed to protect people from. So I guess on one hand it worked, but then on the other hand, yeah, it worked about as well as y'all anticipated it would. A study recently published by the Journal of American Medical Association indicates that there were 2 leading causes of death during the coof pandemic, but neither of them was the coof. Oh, okay. Rather, they were heart disease and cancer. Wow. No shit. The research paper showed the major causes of death in the United States from March 2020 to October 2021. Yeah, that's pretty good. Okay, right from the time when everything shut down. And then, I don't know why October 2021, kind of the end of the fiscal year, I guess. I don't know. Anyways, according to the article, 20.1% of deaths were due to heart disease, 17.5% were caused because of cancer, and if you were taking a look at the infographic beforehand, you're going to see that the coof accounted for 12.2% of all deaths. Wonderful. Is that also parsing out the numbers again when CDC clarified that, you take a look at the numbers and the people who had severe, 3 or 4 different comorbidities on top of the coof, they were the ones actually dropping dead. The people who were, being killed off by the coof, we don't really want to tell you how many of those people are because, again, we like this whole pandemic idea, okay? We like the aura and the auspices and the power that grants, so please don't shatter that for us. That'd be really bad if you did. Cardiovascular disease has always been a leading cause of death, yet the number of heart disease-related deaths during the pandemic has seen an unusual change, okay? According to the National Center for Health Stats, the number of heart disease deaths before 2020 in the United States has been steadily decreasing on an annual basis. It's likely due to an increase in people's awareness of heart disease. Early screening and obviously technological advances. That would make sense. And they even point that out. And technological advances in the medical field, both of which have likely contributed to more preventative measures being taken against heart disease and an enhanced response mechanism to sudden heart attacks. That's all cool and great. However, the number of heart disease deaths started to rise again in 2020. You don't say, of course. Just telling people to stay at home and be scared of everything, telling them to go against everything that they've been thinking about for the past however long. How could that possibly have detrimental effects? It would have been fine if it was just 15 days to flatten the curve, not 15 months to, stay at home and be scared and just collect stimmy checks. So for every 100,000 people, 161 and a half people died. Oh my God, 161 fully formed people and a midget died. Oh no, in 2019. 2020, that increased to 168 at point, I don't know what, 2 of a person. Some pregnant lady who was 3 months pregnant bit it. Number of heart disease complications in critically ill COVID patients are much larger than average. 2020 article published in the British Medical Journal analyzed 5,019 COVID critically ill patients in the intensive care units of 68 hospitals across the United States and found that 14% of them had cardiac arrest and only 12% of those survived the cardiac arrest after receiving CPR. Okay. Number of cardiac arrest cases outside the hospital also saw a significant increase. Many of whom contracted the coof and experienced cardiac arrest at home passed away before the ambulance arrived. Data provided by the Houston Fire Department, for example, showed just this. Forensic data confirms that the increase in such deaths is directly linked to the coof infection. Oh, interesting. Similar situations have also occurred in other countries and regions. So this isn't just particular to the United States. An Italian study, published in the New England Journal of Medicine. That's funny. They got numbers for the United States published in the British Journal of Medicine, and then the New England Journal of Medicine publishes Italian numbers. So everybody's just trying to get in on this. Okay. The number of out-of-hospital cardiac arrest cases increased significantly by 58% compared to 2019, in addition to the number of coof infections was found to be directly positively correlated to the number of out-of-hospital cardiac arrest cases. Also, 77% of all patients who died from out-of-hospital cardiac arrest were suspected or confirmed to having contracted the coof. And speaking of heart disease, I think that there's something else that you probably already know when it involves the heart and what you can do, okay? Something that came out in the early part of 2021 that people were just all too willing to tell you that you have to take in order to participate in polite society. Well, what the fallout of that has been nothing short of horrific, if we're being completely honest. But as you can see by the headline, we're going to have to read this one without adding a whole lot of commentary for very obvious reasons. Myocarditis and pericarditis cases increased significantly after the administrations of the jab. In addition to the coof infections, the administration of the coof vaccines has also increased the risk of heart disease. A study published in the Journal of American Medical Association in August of 2021 by using data collected from more than 40 American medical institutions showed that the number of myocarditis and pericarditis cases increased sharply after around 2 million people received the jab in the United States. The median onset of myocarditis is around 3.5 days after the jab, and there is strong correlation between the time of offset and the time of vaccination. Among the myocarditis patients, 80% developed the symptoms after the second dose. 75% were male, and their median age was 36 years old. So people who should be in their physical primes. Interesting. Yeah, you take a look at how the numbers just kind of skyrocket in March through April and May. Yeah, nothing to see here, folks. Median onset of pericarditis in patients is 20 days after receiving the jab, and in 60% of the cases, the onset symptoms took place after the second dose. Of these patients, 73% were male, and their median age was 59 years old. So, if you didn't get myocarditis because you weren't old enough, look forward to pericarditis. And now we're getting into the interesting questions right now, okay? Because don't think too hard about the other concerns being raised. Just shut up, take the booster, accept the jab. All the jabs, always the jab. Is the second leading cause of death possibly related to the coof pandemic? The second leading cause of death during the first year of the pandemic was cancer. This, however, differs from heart disease, as the number of cancer patients did not have any abnormal fluctuations in terms of data trends during the pandemic. Nevertheless, COVID infections did have an impact on cancer patients during this time period. This is because coof infections can cause chronic inflammation, and an inflammatory factor that directly or indirectly inhibits the functions of immune cells. Spike proteins of the coof virus can also inhibit mitochondrial functions and suppress the cell's DNA repair mechanisms. The aforementioned effects can all cause the degeneration of the immune cell functions, further aggravating the cancer patient's conditions and causing their tumors to get worsen and spread. Oh, great. Wonderful. Fantastic. In addition, since hospitalization rates rose sharply during the coof pandemic, many cancer screening surgeries and chemotherapy appointments had been postponed. Yeah, we knew all about that. Looking at some numbers from Australia, as of May 9th, 2021, Australia had attributed the deaths of 7,509 cancer patients to the pandemic. Interesting. Going to get access for something that could theoretically be at least helped by hospital technology. But no, we'll just chalk them up to deaths and just say, damn you, evil virus. Why won't those damn anti-vaxxers just take the jab already? But how can you reduce your mortality, the risk of heart disease and cancer? Look after yourself, internalize your own health care. No, don't rely on the government, because the government's not going to be there to help you at all. They're just going to be there to tell you what they think is the best thing for you, or the best thing for them, because the people who make the rules only make the rules for their own benefit. And you just keep it a stack on that one. They're going to go ahead and tell you, I just read through this as well. It's like inner peace and meditate. No, just exercise. Do whatever you can with the facilities that are afforded to you. Stop eating like crap. And just whenever you have the opportunity to go in and get a screening, make sure you stay on top of your health. Keep yourself alive, because there's enough people out there that don't want you to. With all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.